It's been a busy week for health across the Caribbean, so these are the stories making up part 1 of this week's health news briefing. More border control measures and event cancellations in light of Ebola concerns. Public health risks increase after Venezuela earthquake. Leptospirosis cases and death rise in the Dominican Republic. More countries announce increase in rising HIV and STI cases. Caribbean recognized as a global leader in eliminating mother-to-child transmission. This when we return on this week's episode of Health Across the Islands. Thank you for making it Health Across the Islands, your Caribbean weekly health news briefing. I'm your presenter, Natasha Robinson-Connor. Haiti has been the latest country to announce new public health measures for travelers arriving from 2 African countries as officials work to reduce the risk of importing Ebola into the country. Under the new protocols, travelers who have recently visited the affected countries will face enhanced health screening and monitoring upon arrival. While Haiti has not reported any Ebola cases, the Ministry of Public Health says the measures are purely precautionary and are intended to strengthen the country's disease surveillance system and protect public health. The announcement comes as several countries around the world continue to closely monitor the evolving Ebola situation in parts of Africa, highlighting the importance of early detection and rapid response to prevent cross-border transmission. The heightened vigilance has also had regional implications, as in St. Kitts and Nevis, organizers have postponed the ACTIF 2026 conference, citing evolving public health concerns linked to the international situation. Officials say that the decision was made out of an abundance of caution and to ensure the safety of delegates expected to travel from across the region and beyond. Health authorities continue to emphasize that there is no immediate threat to the Caribbean, but they are encouraging countries to remain prepared through surveillance, traveler screening, and coordinated regional response efforts. Aid organizations are warning that Venezuela could soon face a health crisis following the recent earthquakes. The earthquakes damaged hospitals, disrupted access to clean water, and displaced thousands of people, creating conditions that increase the likelihood of outbreaks of diarrheal illnesses, respiratory infections, mosquito-borne diseases, and other communicable illnesses. Humanitarian groups say several health facilities are already operating beyond capacity, while emergency responders continue searching for survivors and delivering essential medical care. The disaster has prompted a regional war, with neighboring countries like Trinidad and Tobago stepping in to provide humanitarian assistance. Health experts note that after major natural disasters, preventing disease outbreaks is just as important as treating injuries. Ensuring access to safe drinking water, sanitation, vaccinations, and healthcare services will be critical in the weeks ahead. Health authorities in the Dominican Republic are reporting a worrying increase in leptospirosis cases this year, with 196 confirmed infections and 15 deaths recorded so far. Officials say that the bacterial disease continues to pose a serious public health concern, particularly during the rainy season when floodwaters can become contaminated with urine from infected animals, especially rodents. The latest surveillance report also confirmed 3 new dengue cases and 4 additional cases of leptospirosis, underscoring the continued circulation of multiple water and mosquito-borne disease across the country. Health authorities are urging residents to avoid contact with floodwater whenever possible, maintain proper sanitation around homes, eliminate mosquito breeding, seek medical attention promptly if symptoms develop after exposure. Surveillance efforts remain ongoing. As we highlighted one territory in our last news report, health officials from 2 other Caribbean nations are urging residents to take sexual health seriously following an increase in reported sexually transmitted infections. In Barbados, the Ministry of Health has reported a sharp rise in syphilis cases, prompting renewed calls for routine testing, early treatment, and safer sexual practices. Officials say many infections can be cured if detected early, but untreated syphilis can lead to serious complications affecting the brain, heart, and other organs. Pregnant women are also being encouraged to attend prenatal appointments, as untreated infections can be passed to unborn babies. Meanwhile, in St. Vincent and the Grenadines, Health authorities are encouraging greater vigilance after recording an increase in HIV cases. Health officials in both countries are encouraging residents to know their status through regular testing, practicing safer sex, and seeking medical care if they believe they may have been exposed. Public health experts say reducing stigma remains one of the biggest challenges, as fear and misinformation continue to discourage many people from getting tested. And though some sexually transmitted infections are on the rise in parts of the Caribbean, the region is also celebrating a remarkable public health achievement, as according to the Pan American Health Organization, PAHO, the Caribbean is leading the world in eliminating the mother-to-child transmission of HIV, syphilis, and hepatitis B. One of the region's newest success stories is the Turks and Caicos Islands, which recently made history by becoming the first territory in the Americas. One of the region's newest success stories is the Turks and Caicos Islands, which recently made history by becoming the first territory in the Americas and only the third jurisdiction worldwide to achieve a certification for eliminating mother-to-child transmission of both HIV and hepatitis B. The milestone recognizes years of investment in prenatal care, routine testing for expectant mothers, timely treatment, and strong childhood vaccination programs. Earlier this year, the Bahamas also earned international certification for eliminating mother-to-child transmission, joining a growing list of Caribbean nations and territories recognized by the World Health Organization and PAHO. That list includes Cuba, Anguilla, Antigua and Barbuda, the Cayman Islands, Jamaica, the St. Vincent and the Grenadines, among others. Health experts say these achievements are the results of decades of regional collaboration, expanded prenatal screening, improved access to treatment, high vaccination coverage, and ensuring that mothers receive quality care throughout pregnancy. Public health leaders say the achievement is not only a regional success, but also a model for countries across the world working towards the elimination of preventable diseases in newborns. These are your stories in part 1 of this week's episode. Please stay tuned for part 2.